Northam, as you know, there's been a little bit of pushback around the state against some of your orders on social distancing and shutting down businesses. And earlier today, President Trump tweeted to liberate Virginia. I wonder if you have any response to that from the president urging people to push back like that.
Greg, I appreciate the question. The question was about a tweet coming from our president to liberate Virginia. I would just simply say that as the governor of the Commonwealth of Virginia, I, along with this staff, is fighting a biological war. I do not have time to involve myself in Twitter wars. I will continue to make sure that I do everything that I can to keep Virginians safe and to save lives.
Governor, the president has issued the new guidance on reopening states, and he said, you know, the governors can tailor that approach, but it seems to be geared around robust testing and contact tracing and surveillance. But you said yourself, we're still in a short supply for PPE, for staff, for even testing kits. So can you give us an idea of what you're envisioning for that kind of surveillance and long-term tracking once we start to see a decline and move into some of those phases?
The question is regarding the guidelines that were given yesterday by the CDC, and when can we ease restrictions and how to do that, and what those criteria are. First of all, if one looks, and it's online, so it's very transparent. If you look at those CDC guidelines from yesterday, the first criteria for getting even into phase 1 is to have 14 days of declining cases. And as you've heard the data today, we had 602 new cases, which is an increase of about 8%, not a decrease. So we're not close to that. And we, as I've said all along, we follow that data each day, every hour, and so we'll continue to do that. Secondly, we need adequate testing. We need to be able to test, we need to be able to track, and we need to be able to isolate individuals, looking at hotspots, knowing the trend of this pandemic and what this virus is doing. We are working to improve that on a daily basis, but one of the things that I may add to that is that we have no national guidance on testing. Every governor, and I was on a call with just a little while ago with Governor Hogan, every governor is having to establish our testing protocol and our supplies on our own. So while that improves every day, we're not there yet. We need to know that we have the adequate PPE. You hear us talking about that every day. We just received a shipment. Do we have enough PPE to say that if there's a flare-up or if that curve sharpens, that we have those supplies necessary, not only for the hospitals, but our first responders, our nursing homes? We're not there yet either. And finally, the staffing. And I commend the folks across Virginia that have volunteered to be part of that medical corps, but that's an issue as well. So all of these things are outlined in those guidelines, in the criteria to even get into phase 1, and we're not there yet. Once we are, you know, just like everybody, I want to get back to being as near normal as we can as soon as possible, but we have to be patient, and I would just reiterate and reassure Virginians that the guidelines that we have put forth that you are following, they're working. They're keeping that curve as flat as we can and allowing our hospitals to have the capacity that they need in order to take care of sick patients if and when that surge comes.